Hi, I'm Ed Boudreau. I'm a clinical psychologist and behavioral health consultant.
And I'm Archie Hamilton, a licensed professional counselor and G1 task lead with Adam Alliance.
We'd like to welcome you to this enhanced bite-sized learning. This presentation is the first in a three-part series on basic alcohol counseling strategies. Today we'll be focusing on educating patients on low-risk drinking guidelines. This presentation will highlight the following performance elements. Number one, review of low-risk drinking guidelines. Reviewing low-risk drinking guidelines can help clarify the concept of low-risk drinking and provide specific measurable targets for the individual. Many people have no idea that such guidelines even exist, and this is an opportunity to help them understand how their drinking relates to the guidelines. Two, non-judgmental educational approach. We will demonstrate a non-judgmental educational approach that can help minimize resistance while remaining time-sensitive and efficient to fit within the time-constrained primary care visit. In the presentation, we will show two case examples. Both start with the assumption that risky drinking already has been identified through clinical assessment or structured alcohol use screening. We will not review the screening procedures per se, because this is covered in previous presentations. We'll begin the role play now. Okay, Mr. Hamilton, I just have a final thing I wanted to talk with you about. The screening information you completed before your visit suggests that you might be drinking above low-risk drinking guidelines. And I have just a little bit of information I wanted to share with you about this. Is that okay?
Yeah, sure, Doc.
Okay, great. So this shouldn't take too long. I wanted to briefly review what experts have recommended as low-risk drinking guidelines. Have you ever heard of this, low-risk drinking guideline?
Well, no, not really.
Okay, well, that's fine. Many people haven't. These guidelines are based on a ton of research studying alcohol use and bad outcomes like heart disease or drunk driving accidents or other health problems. I know you don't seem to have any serious medical problems related to your alcohol use right now, which is great, but we really want to keep it that way. So if you keep your drinking below these guidelines that I'm about to share with you, it'll help to reduce the chance that you develop problems in the future. So for a man who is 67 years old, the recommendation is to have no more than 7 drinks a week and to drink no more than 3 drinks on a given occasion. So let's break it down to the two parts. Let's take the first one. So on average, no more than 7 drinks a week. What do you think? Does that sound like something you could consider?
Well, sometimes I already do that, but sometimes I don't, especially on big games.